save and save and save. And then boom.
Good evening, everyone. So, welcome to this clinical masterclass series by PW MedEd. I'm Dr. Jazeer, a dermatology faculty, and this clinical masterclass series, I believe that it is a very important thing, especially for all the medical students, because when you're learning about different subjects, you will not be aware, like always, there will be a thought process like how can we differentiate various diseases and all, and how do we reach out to a proper diagnosis? What should be your thought process? How you should be thinking and evaluating about different diseases and all. So this is the primary intention with the clinical masterclass. Uh, as it is a series, I'll be coming up with multiple rounds of the same session. And once we do some discussions, every time we will have a certain theme in mind. So today's theme, we have not revealed it yet, but in the next slide, I would be talking about what we are going to discuss today. So before I proceed any further, hi Jat J Dagur. If anybody could confirm if my audio and video is all fine, and then let's get this thing started. Okay. So here today, this clinical master class series on dermatology, the topic that I'm going to discuss today is about a red face and how you should approach a facial erythema. Now, we all know that in the dermatology OPD, many times the patients will come to you with any symptoms over the face, right? So, whenever you get any lesion over the face, be it a pimple or be it a rash or anything as such, you definitely is going to seek a treatment very soon because it is the most exposed part of our body and we don't want to compromise on the cosmetological appearance of ourselves, right? So that is why when you get a patient who is coming to you with a red face, so there are a lot of considerations that we should have because the differential diagnosis of this thing called as a red face is not just limited to one or two diseases, but a multiple of them. So we'll be discussing various case scenarios today. So this once again, why a facial erythema would matter is mostly because of the cosmetic impact that it has. That is why many of the patients, if they get a rash over the face, that can lead to a lot of psychosocial distress. Like people would be hesitant to go out to a function to meet people, isn't it? They would like to refrain from meeting people. They would like to stay home till everything gets cleared off. So all these things is going to be one of the reason. And another thing for a good physician is that this red or the facial erythema could be the first visible sign of some internal disease that the patient may have, of some systemic disease. That is another one. And also this thing can actually mimic a lot of conditions as well. So it can be a diagnostic challenge for you once you are going to treat the patient. So it actually requires you to ask a lot of correct questions to reach a good history of the patient and also then finally reach out to the right diagnosis. Very good evening. So now let's see what should be our approach. So just like any other dermatology disease, our approach should be to understand when did the facial erythema start occurring. So like when was the onset? How is it distributed? Like is it unilateral or is it bilateral or is it along some parts of the face, etc.? Or is there any triggers like sunlight can be a trigger, spicy food can be a trigger, and different other triggers as such, and what are the associated symptoms. So all these are going to be the things that you would be asking a patient who has come to you with a facial erythema. So now let's begin the actual discussion today. So the discussion how I have planned today is, let's discuss around 10 to 12 case scenarios. Again, what I would like is all of you who is attending this lecture right now, please try to give your diagnosis when you see this kind of case scenario. Now I'll read out the first case scenario. It's a 24-year-old male with some greasy scaling redness over the nasolabial folds as well as the eyebrows. Now, what comes to your mind as a differential diagnosis in this scenario? So let me just check. Let me just zoom this image for you. This is exactly how the patient has come to you in your OPD. Just imagine that you are the dermatologist today, and let's see how are you going to manage this case. Now here, what I can see is there is some yellow greasy flaking over the eyebrows. There are similar lesions around the nasolabial folds, including the nasal nares and all. And when you examine, closely examine, you would be able to see these kind of rashes in other parts of the face or the ears as well. Any differential diagnosis, whoever is attending right now, would you like to contribute कि ये क्या हो सकता है? There is a greasy scaling is going to be your biggest clue. Now remember, here I'll just tell you that whenever you see something like this, you have to suspect something like seborrheic dermatitis. Seborrheic dermatitis. Now all of you know very well. Yes, no problem of attending the classes. So what we will do is today, what we are going to do is, even though you have not read dermatology, this is like one, just try to understand what are the various clinical scenarios and how do we approach them. Okay? And we will not be going into so many hi-fi things, but a very common differential diagnosis. Now, regarding the seborrheic dermatitis, remember the common name of seborrheic dermatitis is what we call as dandruff. I'm sure all of you know what is a dandruff, right? So we always get these kind of yellow flaking over the scalp. That is the most common thing. But remember, seborrheic dermatitis is not essentially seen over the scalp alone. It can be seen over other seborrheic sites in the body. So in the seborrheic sites, all these things will include like the forehead, the cheeks, the chin area, behind the ears, over the upper part of the shoulders, anterior part of the sternum. All these places can be a site of seborrheic dermatitis. Yes, by definition, Supata Sumanta, we always feel that those whitish flakes that you see over the scalp, those are white, but when we see it over the face, you would be able to see a yellowish greasy flaking. That is exactly how all the dermatology textbooks describe seborrheic dermatitis. Okay? So so in the cases of seborrheic dermatitis, what you should remember is, why does a patient get seborrheic dermatitis? Because this is caused due to a yeast. And what is the name of this yeast? The name of this yeast is going to be Malassezia. So it is going to be due to Malassezia furfur. So this is a commensal yeast which is present in all of our body, and the patient can come to you with this kind of a thing. Now here, when it comes to the diagnosis, not yellow colored face. So I'll just zoom this image for you once again. The yellowish, greasy flaking, these kind of scaling that you can see in this patient, that is considered to be yellow. Not that the face has turned yellow in color. It is about the rash we talk about. Okay? Now, why are we talking this in facial erythema? Because you can see that all these things are having a background redness as well. That is the reason why we are taking this as one of the differential diagnoses for facial erythema. Now, how do you diagnose? For a good dermatologist, this is going to be a clinical diagnosis. Because you see the patient, you see these kind of yellowish, greasy flaking, then you understand that. Yes, Sapata. Yes, correct. So in the scalp, it more or less looks like whitish color scaling, but in the face, when it is adherent to the skin, it looks like yellowish. Okay? And here, and how do we finally treat this patient? Now, how are we going to treat? क्योंकि ये तो clinical diagnosis था. So you saw the patient and you understood कि हाँ ये this is going to be seborrheic dermatitis itself. So in the case of seborrheic dermatitis, since we are going to deal with a fungus called Malassezia furfur, the treatment should be, आप लोगों ने एंटी डैंड्रफ शैम्पूज यूज किया होगा, isn't it? तो एंटी डैंड्रफ शैम्पूज, स्पेशली मेडिकेटेड शैम्पूज में क्या होता है, देयर इज गोइंग टू बी fungus and antifungal agent, right? So like ketoconazole. So you can go for some ketoconazole cream or ketoconazole shampoo or a lotion. All those things can be used. Along with that, we may also use a mild potent steroids. Okay, we'll use a mild potent steroids. So this is going to be one of the differential diagnosis for a red face. For a red face. Yes, Rohit Abbas, ketoconazole is correct. Selenium sulfide is another thing which is available. Even in these cases, to reduce the inflammation, we can also use calcineurin inhibitors. All those things are possible. So now let's go to the second case. Now, again, you are getting a patient who is having a facial erythema. This time, a 35-year-old female, and she is complaining that she is having flushing, okay, flushing along with telangiectasia. And see, she says that there are some triggers because every time she goes to the sun, or when she is exposed to the heat, or when she is taking some spicy food, or if she is stressed, she feels that this flushing is increasing. Is going to be, yes, for dandruff in the hair we can definitely use ketoconazole shampoo. Definitely you can use, Samantha. Okay, so now coming back to this, I'll just zoom this for you. So once I zoom this, so we can see that once I closely examine this patient, what I can see is, can you appreciate these small red blood vessels over the skin? So these small red blood vessels over the skin, the visible blood vessels over the skin is called as telangiectasia, right? It is called as telangiectasia. And what do you think is the diagnosis here? Red face, malar rash. I would say it's a very good differential diagnosis because it looks like a malar rash. Excellent. But however, in malar rash, we always think about SLE, right? But यहाँ पे alcohol, stress, spicy food and all does not worsen the symptom. And the most important thing that the patient is telling me is flushing. So where do you find this flushing is in a disease called as rosacea. And what type of rosacea is the one that you're seeing in the screen right now? This is called as erythematotelangiectatic type of rosacea. So this is erythematotelangiectatic type of rosacea. Now see the name of the disease. It is self-explanatory. Erythemato matlab red color, isn't it? Telangiectatic, telangiectasia matlab these dilated blood vessels that you can see. So erythematotelangiectatic type of rosacea. And why am I able to reach out to this diagnosis of rosacea so easily is because of this most important symptoms that this patient has, which is called as flushing. क्योंकि SLE में कोई flushing नहीं होता. The flushing is only happening in cases of rosacea. It happens only in cases of rosacea. और यहाँ पे it is more or less again a clinical diagnosis. That is why you all should be a good physician. You should be able to make out a good clinical diagnosis. But in these cases, just like Samantha, Spam, Rohit, all of you said about telangiectasia, right? All of you have told about SLE, right? So इसीलिए we can do a ANA screening of the patient as well. We can just rule out whether the patient is having any lupus, isn't it? Systemic lupus erythematosus. And also in this condition, we can also do a KOH test. क्योंकि KOH test you all must have learned कि we do a KOH test whenever we suspect a fungus, but KOH can also detect a mite. So here we can also see for Demodex mites. So here we can also see for Demodex mites. So यहाँ पे in the cases of rosacea we can treat the patient, like the treatment can be with topical metronidazole. So we can treat the patient with topical metronidazole. In some cases, we can go for oral doxycycline. Oral doxycycline can be used. and brimonidine. So for the erythema and all, what we do is that we can use brimonidine, etc. Okay? That is how we take care of this case called this take care of this condition called as rosacea. Now, some of you is asking about what is the meaning of flushing. अभी यहाँ पे देखो, this is the patient who has come to you with erythema, right? Flushing का मतलब बस यही है कि the patient is feeling some hotness, warmth and all, which comes and goes, which comes and goes. So this can be a very disturbing symptom for the patient. Whenever the patient is stressed or whenever the patient is consuming some pickles or some spicy food, even tea or coffee, the patient feels that there is some flushing that is happening. Flushing matlab there is some hot feeling, warmth feeling. It comes and goes. इसी को बोलते हैं flushing. I hope that is clear. And Demodex is a mite that you can see. If we just take a scraping from this part and all, and when we examine under a microscope, you can see some small mites which is present under the skin in the face. So these kind of mites, they are called as Demodex mites. They are called as Demodex mites. नहीं, SLE में कोई telangiectasia नहीं होता. So there is no telangiectasia in SLE. So now let's see the next one. A 40-year-old female presents with red bumps, pustules, but no blackheads. But no blackheads. Now यहाँ पे again it can be a bit of confusing. I'll just zoom this for you. Now again what is happening is you can see that the rash is present like this. Just like how you will always again suspect about a malar rash. But यहाँ पे it's not only about the rash. You can see that the patient has developed multiple bumps on pustules as well. So these bumps are mainly going to be papules, right? So this is going to be again a papule, as well as you can see there is pustule. So this is called as papulopustular rosacea. Papulopustular rosacea. So the takeaway message here is, now all these are different types of presentation of rosacea. These are different types of presentation of rosacea. So please remember, everybody in the medical college, every student, whenever you see a red face, everybody says SLE. That is one of the top differential diagnosis that everybody is able to say. Along with SLE, you should always keep this disease called as rosacea into your list, because rosacea is a condition where a patient can present to you with erythematotelangiectatic type of rosacea या फिर papulopustular type of rosacea. And papulopustular type of rosacea, और यहाँ पे we can easily rule out acne vulgaris because there is no blackheads or whiteheads, isn't it? अगर blackheads या whiteheads होता, this could have been an acne rosacea. But since there is no blackhead or whiteheads, this is going to be called as papulopustular rosacea. See, how rosacea occurs. This is a disease which involves the hair follicle as well as a sebaceous gland. So it's a disease of pilosebaceous unit. Okay, and many a times this is seen in middle-aged patient, and the actual etiology of this disease is not very clear, but this always involves the hair follicles as well as the sebaceous. Okay, so blackheads and all we talk when we see about acne. Abhi, let's see the next case. So यहाँ पे we have a 14-year-old male with comedonal lesions over the forehead and the cheeks. Now what can this be? I'll just zoom this image for you. So what do you think कि यहाँ पे भी face में थोड़ा redness है, there is going to be some erythema in the face, and there are so many small lesions over the face, multiple, right? So many small lesions over the face. Now in the question itself, it is mentioned कि ये lesions are called as comedonal lesions. Now what are these? And you have one more clue here that this is a 17-year-old, मतलब adolescent है या फिर teenager है, or in teenager you can see this comedonal lesions over the forehead and cheeks. Very good. It is going to be acne vulgaris. Acne vulgaris. So you got it right, but I can only call you as a spam, isn't it? Your name is shown as spam. So chalo, let's see what happens here. Why do I say that this is acne vulgaris? Because of this term called as comedonal lesions. Because what happens with comedones is there are two types of comedones which we can see, and these are called as the black heads and the white heads. These are called as the blackheads and whiteheads. So whenever we see anyone with a face with the lesions over the face, and whenever they have either a comedone, या फिर papules, pustules, nodules and cyst, then we can call it as a acne vulgaris patient, right? तो यहाँ पे blackheads का मतलब क्या है? Blackheads means these small lesions which is present over the face, they will open up. So once they open up, because of the oxidization reaction, what happens? These comedones, they turn black in color. So are they open comedone or closed comedones? These are going to be open comedones. These are going to be open comedones. At the same time, what happens with whiteheads is that all these small lesions which is present over the skin, these are not opening up, मतलब ये closed होता है and there is no oxidization reaction, इसीलिए the lesions they look white in color. So these are called as closed comedones. So these are called as closed comedones. So that is about acne vulgaris. और acne का treatment जो है, it is a pretty big topic on its own. And acne also, since it is a 100% clinical diagnosis, you need not do any investigation here. And if you ask me how do we treat this patient, यहाँ पे जो treatment है, it should be with topical retinoids. क्योंकि every type of comedonal acne is treated with retinoids, and these retinoids, the examples are can be adapalene or tretinoin, or it can be tretinoin. Okay? Yes, propionibacterium acne, that is going to be the causative here as well. Excellent. So now let's go to the next one. A 26-year-old woman with a rash over the cheeks and or rash and a joint pain and oral ulcers. Now, what can this be? I guess now you have got the actual case which you all of you already knows about it, right? Facial erythema matlab यहाँ पे देखो what is happening. यहाँ पे the rash is something like this, and here also the rash is something like this. Yes, Fatimatun Nisa, Supata, Samantha, all of you are answering. So this should be what is called as systemic lupus erythematosus. So in SLE, all of us know that we call this rash as a malar rash. So what does a malar rash mean? Yes, classic butterfly shape. Excellent. So this is the butterfly shape, and there is a sparing of the nasolabial folds. So all these symptoms जो है जैसे joint pains हो गया या फिर aphthous ulcers या oral ulcers, all these things are very very typical of systemic lupus erythematosus. And whenever you find a patient like this, you will be asking, every time you go to the sun, is this rash becoming more severe or not? क्योंकि ये rashes जो है, these are going to be photosensitive rash. Photosensitive rashes, right? So in the cases of SLE, when a patient will come to you, they can tell you a lot of symptoms. But why does a patient of SLE comes to the dermatology OPD and not going to the internal medicine OPD? The main reason is because of this rash. क्योंकि they would be having a lot of other symptoms जैसे joint pains, arthralgia, sometimes renal involvement, neural involvement, all those things can be there. But the patient will rush to the dermatology OPD just because this thing is in the face and they wants to get this thing sorted at the first. Okay, that is why. Yes, excellent. So here what do we do is, here we definitely, since it is a systemic disease, we will have to go for a lot of investigations. Like we will always screen for the patient for anti-nuclear antibody, and we can also check for anti-dsDNA, isn't it? We can check for a ENA panel, isn't it? So and also we can check the complete blood count, क्योंकि hemoglobin, the entire counts, everything is going to be low in these kind of patients, including the ESR. You can also check for the urine analysis and all. So all these investigations are done, and we have to rule out any other systemic involvement as well. And can anybody tell me ki any drug that you know, all of you who is listening to the lecture right now, can you tell me any drugs that can be used for the management of SLE? So what should be the treatment? एक treatment जो है, that is going to be photo protection. But what I'm asking all of you is, do you know any drugs that can be used? Topical steroids. See, whenever it is in the phase, na, try to avoid steroid as much as possible, because of steroid itself, there can be a lot of side effects. Okay. So anything else? Yeah, steroids, oral steroids, I would say oral or systemic steroids we can use. Anything else other than steroids that we can use in the case of SLE? That is going to be, yes, steroids is right, or oral can be used. Anything else? It should be hydroxychloroquine. Okay, hydroxychloroquine. So hydroxychloroquine can also be used, and many other immunosuppressive agents can also be used. So that is about SLE. Now here, please keep in mind, this is also one of the differential diagnoses for a facial erythema. Now let's see another case, and let's see who can answer this condition. There is a 52-year-old male patient who is coming to you, and when you examine, you can see that there are rashes over the eyelids. There are some rashes over the knuckles as well as the interphalangeal joints. Who can answer? If you want, I can zoom this image for you. So यहाँ पे what I can see is, a patient has come to you. यहाँ पे all those areas there is a purple color or a violaceous rash, and you can see that there is a rash something like this, and there are rashes over the knuckles, and there are rashes over the interphalangeal joints. LP. Very good differential diagnosis. Very good thinking, because the moment I said violaceous, yeah, purple, probably that is the reason why you must have said about lichen planus. It is a good differential diagnosis. Vitamin deficiency, very less likely. Vitamin deficiency also, since you have these kind of rashes like pellagra and all, can be a differential diagnosis. Okay. Anything else comes to your mind? So this one, okay, let me just add some of the clinical features as well. So once I'm taking a history of this patient, कि चलो आपका फेस में ऐसा एक violet color rashes है, knuckles में भी rashes है, and there is a rash over the upper back also. Is there any other symptom? Is something what I'm going to ask the patient, and the patient is saying कि हाँ कुछ और symptoms भी है, but that is not related to skin. चलो ठीक है, फिर भी बताओ कि कौन सा symptom है. Then the patient is telling you कि these days I feel that whenever I'm combing my hair, I feel that there is a lot of weakness in my muscles, or I feel very tiresome. या फिर my home or my office is in the second or third floor. So whenever I climb the stairs these days, I feel that there is a weakness in my muscles, in the muscles of my upper part of the legs. So let's say muscle weakness is also present. So now can you make out a diagnosis? तो यहाँ पे diagnosis क्या होना चाहिए? The diagnosis should be, there is skin symptom, muscle symptom. That is the biggest clue I can tell you. Skin plus muscle symptom. There is a disease called, 2 more seconds before I reveal the answer. It's called as dermatomyositis. It is called as Dermatomyositis. So in dermatomyositis, why is this a differential diagnosis for a facial erythema? Is because in the cases of dermatomyositis, you get something called as a heliotrope rash. And this heliotrope rash is going to be over the face, especially over the eyelids, especially over the eyelids. And what is the meaning of a heliotrope? Heliotrope means it is a flower. Okay, it is a flower, and this flower is having a color of violet color or purple color. And यहाँ पे this image जो है, that is wherever you get these rashes over the knuckles and the interphalangeal joints, this is called as Gottron's papules. Very important when you learn medicine. So this is called as Gottron's papules. I am Rish. And what is this image? जहाँ पे where you can see that there is a rash over the upper part of this back, that is called as, yes, that is called as shawl sign. It is called as shawl sign. So this is about dermatomyositis. It's a very important disease when you learn medicine, isn't it? Where a patient would be having a progressive muscle weakness along with a lot of skin symptoms, Okay? And in these kind of patients, it can be a marker of malignancy. So you will have to rule out for any malignancy. So a screening for malignancy is very important as well. Okay. So now let's go to the next one. Now, a patient is coming to you with a complaint saying that there is a rash in the face, but after the use of a fairness cream. I'll just zoom it for you. Now, यहाँ पे the patient herself knows that what is the reason for the rash. क्योंकि the patient must have ordered something online, isn't it? Something that is not branded. You don't know what is the content of these creams, and she must have applied it over the face for fairness, as a fairness cream. Now, as a fairness cream, once the patient is going to use it, the patient is going to develop these kind of reddish allergic rashes over the face. So yes, I'm getting an answer that this is hypersensitivity reaction. G, it's a hypersensitivity reaction. But I'll just correct you. ये type 1 hypersensitivity नहीं है. So this can be, let me just correct you. It can be hypersensitivity reaction type 4. Type 4 matlab it is going to be a delayed type of hypersensitivity, isn't it? Now, can you tell me the exact diagnosis here? Because of contact with something and after repeatedly using something, the patient has developed these kind of allergic rashes over the face. So what can this be? This can be called as allergic contact dermatitis. So this can be called as allergic contact dermatitis, isn't it? So for this allergic contact dermatitis, you will have to do some patch test and all. You will have to avoid the allergens and all. So that is how we can make out a diagnosis that this is going to be dermatitis, isn't it? Because why? Because most of the cosmetics or plant antigens and all those things, these can cause a contact dermatitis, which is called as allergic contact dermatitis. Just like how all of you have explained, this can also be because of a hypersensitivity reaction, and this hypersensitivity reaction is usually due to type 4 hypersensitivity. और यहाँ पे delayed type hypersensitivity क्यों होता है? Because when the patient applies the cream for the first time, कोई symptoms नहीं होता. When the patient is applying it repeatedly for second day, third day, fourth day, finally fifth day, the patient's body will start reacting. Okay, and that is why we call it as a contact dermatitis. See, contact dermatitis matlab you get an allergic rash because of contact with anything. It can be an allergy to a wristwatch. It can be an allergy to bindi. It can be allergy to mehendi or henna. isn't it? All those things are considered to be contact dermatitis. Basically, this also can be a case of contact dermatitis, which is also a case of hypersensitivity reaction. So now going to the next one. Now we are getting another patient again with the same symptom of facial erythema. But patient क्या बोल रहा है कि the patient is getting some itchy red face after sun exposure. Now, why sun exposure? I'll just zoom this image for you. Now, when I zoom this image, I can see that अगर ये acne vulgaris होता, मतलब normal pimples would have been restricted into the face. You will not find these kind of bumps over the ears, right? Now here what is happening is the patient is having these kind of lesions, and when you see these lesions you understand very well because of the distribution of the lesion that these are sun exposed area. The patient will also tell you that when I went to the sun, I got this thing because I started getting some itchiness over my face, and there is a lot of bumps now over my face, and in the entire area where there is a sun exposure. Now this can be due to photodermatitis. So this can be due to photodermatitis. Okay? Now what is photodermatitis? So this can be an immunologically mediated eruption which follows after an exposure to sun exposure. This is more common in young women, even though the most common sites can be over the neck region, over the anterior part of the chest and all, but still you may still get a itchy red papular lesion over the face with a background of erythema. This is again going to be another clinical diagnosis. If you want, you can go for a photo patch testing in chronic cases. Okay, clinical diagnosis. And you can go for a photo patch testing if it is going to be a chronic, if it is going to be a chronic thing. So in these kind of patients, yes, can you zoom the image? Yeah, why not? See, in these kind of patients, how you will see is a patient will come to you. Let's say a 24-year-old young woman has come to you, and she's saying that मेरे face में इतने सारे rashes हैं, and these kind of rashes is happening because I am exposed to sunlight, because I have to walk a lot from my home to the office or someplace, and because of the sun exposure I feel that I'm getting a lot of itchiness as well as these rashes. Now when you examine the patient, you will see that the rash is not present only over the face. There is some rash over the neck, over the ears, over the anterior part of the chest region and all. Then it will give you an idea कि ये कोई photodermatitis हो सकता है. And one of the most common type of photodermatitis is a polymorphous light eruption. Okay, polymorphous light eruption. Polymorphous light eruption. That is PMLE. यहाँ पे what is the best advice you can tell the patient? That is my question for you. What is the best advice that you can give this patient who is coming to you with a polymorphous light eruption or a photodermatitis? The treatment here should be anyone, something that we should be using during daytime. Every time you go out to the sun, that is something that is unavoidable. Yes, sunscreen, right? So you can go for a sunscreen with sun protection factor more than or equal to 30. So at least with SPF 30 should be given. If it is more than 30 also it is better. Yeah, avoid sun exposure and also use sunscreen can be one of the best thing. And for a short period of time, since the patient is having itchiness, you can go for antihistamines like levocetirizine, cetirizine, fexofenadine, loratadine. All those things are going to be antihistamines that can also be used. And other than that, we can also go for a short course of a mild steroid. Okay, mild steroid, short course can be given. Short course. Okay, that is how we can treat this case of polymorphous light eruption or photodermatitis. So now let's see another one. Now we have a diabetic patient who is coming to you, and the patient is complaining of redness, some hot sensation, swollen cheek, and there is fever. So till now, whichever patient that we have seen with a red or a facial erythema never had fever. So now all women during young age use sunscreen. Further, it's not only about women, it's about everyone, be it males or females. It is always advisable to use a sunscreen to avoid any kind of a photo damage. Okay? And even if you are indoors, it is going to be better that you apply a sunscreen. And now coming back to this next case. Now we have got this ninth patient today who is having a red color face. And this, what is this patient having? Patient is having fever along with red skin over the face. Now this is how it looks like. Anybody knows that why fever? Whenever you see this fever, you are forgetting about many other differential diagnosis. क्योंकि ये रोजेशिया नहीं हो सकता. Some cases of SLE में fever हो सकता है, that I agree. And ये acne नहीं हो सकता because in acne there is no fever. This cannot be dermatomyositis. This cannot be contact dermatitis. Then अगर fever है, then what can it be? Very good, Supata. She's saying that it can be an infection. So I completely agree with you. Because of fever, think about infection. And what should be this infection? SP is answering the right one. So this should be a erysipelas, right? Erysipelas. So this is an infection which is caused by streptococcus, where a patient can come to you with a red color face and there would be some warmth over this lesion, and you can see that the borders of the lesion is well defined. Based on all these things, we can diagnose it as a erysipelas. We can diagnose it as erysipelas. So what happens in this erysipelas is because of the streptococcal infection, the patient is getting all these kind of symptoms. Since it is going to be caused by a bacteria, the treatment should be IV antibiotics or even tablets of antibiotics, right? So that is about this case. So now moving to the next one. Now we have got another patient who is having an erythema. But here it's not red. We are having a purple colored plaques over the nose and the cheeks. What can this be? So patient is having purple colored plaques over the nose and the cheeks. So what is this going to be? Anybody who has the answer? Because any patient who is having these kind of purple colored lesions over the nose and the cheeks, this is going to be very typical because this can be due to sarcoidosis. Okay, this can be due to sarcoidosis. So this also should be one of your major differential diagnoses. Is that clear? So now going to another case, rhinophyma. No, this doesn't look like rhinophyma because rhinophyma can also be associated with rosacea. It's a good thinking, but in this case, it does not match with it. Now, next one. Once again, a patient is using a whitening cream, and after that, the patient is developing red, shiny, thin skin with acne-form eruptions. What is this? So I will zoom this image for you. So earlier what had happened, somebody was using a whitening cream. After that, some allergic kind of a reaction had happened, right? जो allergic kind of reaction I told you, it can be because of allergic contact dermatitis. पर अभी क्या हुआ? After using a whitening cream, the patient is not coming because of an allergic reaction, but the patient is feeling that the skin is becoming more thin. So what do you mean by this thin skin? Thin skin means skin atrophy. Okay, it means that there is skin atrophy, and along with that acneiform eruptions हो रहा है. There is acneiform eruptions. So Fatimatun Nisa has got the right answer now. So she's saying it is TSDF. Abhi, what is this TSDF? What is the full form of TSDF? It's an amazing, very good diagnosis. The diagnosis है. It is going to be TSDS. And what is this? This is called as topical steroid damaged skin. So it is going to be a topical steroid damaged skin. Because everybody knows very well that you should be very cautious when we use this topical steroids. Topical steroids, you must be knowing about betamethasone, clobetasol, all those things. Like clobetasol and all is a very highly potent steroid cream, which you are never supposed to use it over the face. Because whenever we use something over the face, even if you have to use, you have to go for a very low potent steroid. जैसे desonide creams can be used, momentosone creams can be used. Those are going to be low potent steroid creams. You should never use even a mid potent cream like betamethasone. Now, if a patient is using that, initially what happens, the patient feels that the skin is becoming more fair, isn't it? So they have a much better skin. But when they continue to use it, you can see that there is something like this. So what is this finding? This finding is called as, I think we have discussed about this finding earlier when we learned about rosacea. Can anybody make out what is this finding that you see in the skin? I've tried to zoom in maximum. What is this that you see? I guess you should be able to answer it. I can see some dilated vessels over the skin. So what is this dilated vessels called? Yeah, Fatimatun Nisa is answering. This is called as telangiectasia. So this telangiectasia, skin atrophy, acneiform eruptions, all these things are going to be a long-term side effect of what you call as steroid creams. Okay, steroid creams. It can also cause perioral dermatitis. It can cause some burning and sensitivity. All those things are considered to be the side effect of a steroid. और यहाँ पे diagnosis है TSDS, that is topical steroid damaged skin. So now let's see the next one. So till now we were getting a patient who was an adult. Now we have got a child who is coming to your OPD, and this child is having a mild fever along with red cheeks. So I'll just zoom this image for you. This is how the child looks like. Now what comes to your mind? Anyone? Child, fever, red cheeks, and some rashes over the trunk. I think this is also pretty much easy for you to guess the diagnosis. 3 seconds for you. So yeah, parvovirus. Very good. So this, somebody has texted, Vikash Raj has texted saying that this is due to parvovirus infection. And what is this parvovirus infection called? This is called as the fifth disease. It's called as the fifth disease. Or यहाँ पे in the fifth disease, what happens? The kind of appearance that you see in the screen right now, this is called as slapped cheek appearance. So this is called as the slapped cheek appearance. So this is also, this erythema is called as erythema infectiosum, and this is seen in a disease called fifth disease caused due to parvovirus. Yeah. So in all these cases that we have discussed, we have only discussed about 12 cases, but see, when I talk about facial erythema, we have a long list of differential diagnosis. And you have also seen that every patient was presenting to you with a different kind of a symptom. So what is most important? The most important thing is you take the correct history. You should ask a lot of questions. How did this lesion appear? When did these lesions appear? And how the lesions have progressed? Is there any trigger, etc.? So when you ask all these questions, based on the answer that the patient will tell you, you will be able to make out a lot of differential diagnosis. And generally speaking, for facial erythema, we will have to go for a complete blood count, uh, ANA testing, ESR testing, anti-dsDNA, patch test when it comes to allergic contact dermatitis. If you want to rule out any fungal infection like tinea faciae and all, then you can go for a KOH mount. And whenever the diagnosis is unclear, you can go for a skin biopsy as well. And these are some of the red flags that we should have. Like whenever you find a facial erythema with redness, just like how you have answered it right, you have to always suspect a infection. When some systemic symptoms are involved, like proximal muscle weakness and all, then you can think about dermatomyositis and all. And if it is happening in someone in the elderly patient when with facial erythema, then it is important to rule out malignancy, just like how what happens in dermatomyositis. And also some ulcerated lesions, crusted lesions and all would again raise a suspicion of autoimmunity and malignancy. Now, when it comes to, yes, clinical diagnosis matters. And main counseling point is, from our discussion today, you have understood that you should never recommend anyone to go for any OTC steroids. Like just go to the pharmacy, get some steroid creams, and applying it over the face is definitely going to have a bad effect. And always be careful with the fairness creams that patients are using. And we have to reassure the patient many of times. Reason is, many of these conditions are chronic conditions with some remissions. Just like photodermatitis and all, it can come back again and again. SLE, again a chronic condition, isn't it? And a good adherence to skincare habits is essential, especially using sunscreens and all. And the final takeaway of today's session is that facial redness is not always acne, and it is not always because of SLE, isn't it? And we have to have a good systematic approach, and we have to rule out any systemic disease. Yeah, OTC means over the counter, because when you go to the pharmacy, you ask for a betamethasone cream, you ask for clobetasol cream, any creams, you can easily get it without a prescription today in India, right? So that is again going to be a reason for misuse of these steroid creams, which can lead to a lot of side effects like what we have discussed in today's session. Okay, so that is all about today's clinical master class about facial erythema. So I hope that I was able to give you some insights about what should be a thought process when you evaluate or when you see a patient who presents to you with a facial erythema. And in the coming days, we'll come up with more such general topics which will help you to make a good clinician in you, and will be able to make out or to narrow down the differential diagnosis. So thank you so much for being a very interactive crowd, and we look forward to interacting more in the future. Thank you so much.